Hello, hello. Welcome to this Whitman-Walker Live. I'm Brendan. I'm just gonna wait for a few people to trickle in before I get going with the content. Also, I'm gonna bring on special guest Marshun. And ready? Here he comes. Hello, Marshun.
Hey Brendan, how are you?
I'm doing really well. I am enjoying being at home while it's really cold and rainy outside.
Must be nice.
Yeah, I'm sorry that you had to go into work today. How is your commute?
My commute was actually really chill, minus me getting my suede shoes wet, but other than that, it was good. I got me some coffee, of course.
Good.
So
Good.
yeah,
That's awesome. Any sweet green today, or was that just last week?
it's giving Chipotle for me today because too much of that sweet green, you know where it's gonna have you, and I'm not trying to deal with all of it today.
I feel that. Yeah, sweet green, it's good, but you gotta have some variety. I would probably choose Chipotle too.
Not saying I won't take one home for dinner, but for lunch, it's giving no.
Good to know. Good to know. I totally agree with that.
Yes. What are you eating for
Okay.
lunch?
I usually just have like a bagel with cream cheese. It's really easy and like pretty cheap, and it gets me through. I like to have a bigger dinner, so it's just kind of like a nice snack to get through the day.
Yeah, I used to eat bagels and cream cheese like in high school when my parents would force me to, but growing up, I was like, no, I can't.
But now that you're not forced to, you wouldn't do it.
Mm-mm.
Okay, got it.
I'm a more
Um,
toaster strudel. But anyways, Um, we got a few people tapping in. You want to wait just maybe like a few more minutes?
yeah, maybe like we can start introducing ourselves
Yeah,
and like
and people can
session.
just jump in.
So, for those who don't know, my name is Brendan Pulsifer. I work at Whitman-Walker as the social media outreach HIV prevention coordinator. My pronouns are he, him, his.
And hi everyone, it's the Whitman-Walker Live OG. Me, Marshun. I work here at Whitman-Walker as a community outreach specialist. And yeah, of course, whenever Brendan and I jump on Instagram Live, we're always gonna drop some gems and of course get into some things. So today we're going to be talking about the three most commonly reported STIs. Brendan, any idea what they may be?
Big three, ready?
The big
Gonorrhea,
three.
gonorrhea, chlamydia, syphilis.
It's like you work here. Like,
It's like
whoa.
we know what we're doing.
It's
Yeah.
like we know what we're doing.
Yeah. So when I say gonorrhea, chlamydia, syphilis, they sound pretty scary. Like they're diseases, they are sexually transmitted diseases. Like you probably don't want to get them. The good news about all of the three that we're going to talk about today is that they're all treatable. They're just bacteria. You can get antibiotics, and you can get them cured really, really easily. So if you're tested and you discover that you have one of these three, you take medication, it's totally gone.
Yes, and Whitman Walker's free HIV, STI testing and counseling services will test you for chlamydia, gonorrhea, syphilis, and HIV. And if you test positive, we can easily get you connected to treatment. Just give us a call at the number below. And you know what? We need to pin that number.
Yeah, I'm gonna put it up
Um,
right now.
we're gonna pin the number for you to reach us at. And I'll just say it out loud. It's 202-797-4439. If you want to schedule an appointment, you can schedule an appointment at our Southeast location or our Northwest location. We're not taking walk-ins at the moment, so just give us a ring and we'll place you on a schedule and you can pull up on us.
Yes. All right, I think I just pinned the comment right now. Yeah, it's by appointment only.
Yes.
Okay. Now that that's out of the way, let's start jumping into the content. We're going to talk about the most commonly reported STI in the US
But
first.
and we actually have a question in the comments.
Oh my God.
Can you get tested with all if you live outside of DC? Yes, yes. You can most definitely come in and get tested for HIV and STI. You don't have to live in DC. It's not just specifically designated for DC residents. There we go.
Yeah, and what's nice is it's free. Like we don't take insurance. Like we don't even know
hmm
where you're from. You know, like you can just come in.
Right. Okay. So what were you saying, Brendan? I'm sorry. I feel like I cut you off.
Oh, no worries. We're just gonna start with of the three, the most reported STI in the U.S. Can you guess which of the three that is, Marshawn?
Um, I feel like I hear so much about chlamydia, and then like gonorrhea is secondary, and then syphilis. Even though syphilis is highly reported, but for this specific question, I'm gonna say chlamydia.
I think that you are totally correct about that. And chlamydia, CDC estimates that nearly 3 million new infections occur in the US every year, and two-thirds of those infections are in young people ages 15 to 24. The distribution of the disease reveals like some health disparities. It's nearly 6 times more prevalent among Black folks than white folks, and it's also really common among men who have sex with men, or MSM populations.
Yes. Now, Brendan, how do you think you get chlamydia? Like, can you get it from like drinking after someone, like wearing someone's mask? Like, how do you get chlamydia?
So there's a reason that we call chlamydia a sexually transmitted disease. You can't get it from drinking someone's drink. It's not that kind of thing. You can get chlamydia through sexual contact.
Okay. So yeah, that's right. Bacteria can sometimes live in your penis, your vagina slash front hole, your mouth or anus, and they get passed on when you make sexual contact with individuals. And those areas can actually infect your partner. Additionally, chlamydia can get passed from mother to child during childbirth. That all means that any sexually active person can get chlamydia even if you've already had it before.
And Marshawn, is it true that if you have chlamydia, you might not know it?
You know what? Let's ask them in the comments. So you guys, what do you think? Will you know if you have chlamydia? Like, will you experience its symptoms? Will you just get tested and find out you have like what are you guys thinking? Because you may not always know you have chlamydia. So let's just see what the comments say before I drop this tea.
Talk out loud. I feel like when I have an infection like strep or something, I know when I have it. So, but Big Lessie in the comments says it can be asymptomatic. Is that true, Marshawn?
It most definitely can. Um, and I'm not trying to surprise you guys, but chlamydia is often called the silent infection, mostly because most people are asymptomatic. As few as 10% of men and 5% of women show symptoms of chlamydia, which can be included in the urethral or rectal discharge, painful urination, pain and discomfort in the abdomen, pelvis, scrotum, and rectum, and it can sometimes occur bleeding in the rectum or your vagina slash front hole. That's why it's always important to get tested if you have chlamydia. You probably may not even know.
So if only like 5 or 10% of people show symptoms, that means like 90 to 95% of people who have it don't have symptoms. That's wild. That's so big.
Right. Which is why, we always suggest and recommend routine HIV STI testing just because you really just never know.
Yeah. And we've already said that if you test positive for chlamydia, it's really easy to treat with antibiotics. So it just kind of makes sense to get tested and then treated if necessary. But what if I
Right.
don't treat it?
So that's a great question, Brendan. So untreated chlamydia can cause serious and permanent health problems like pelvic inflammatory disease, ectopic pregnancy, infertility, and reactive arthritis. Having chlamydia also increases your chance of acquiring and transmitting HIV.
Okay, yikes. So I feel like if you're sexually active, you definitely want to go ahead and get tested. Um,
Definitely.
I'm going to repeat that the number, if you want to get tested Whitman-Walker, call for an appointment at 202-797-4439. Pinned in the chat below, too. Huh.
Yes, we have pinned the number for you to call, and once again, we can schedule at any location for HIV, syphilis, chlamydia, and gonorrhea testing. It's all free. But anyways, I also want to make sure that you're preventing against getting chlamydia. So you guys, you can do a numerous of things. Use condoms correctly. Talk with your partner about their status. Consider having long-term mutually monogamous relationship with the partner who has been tested, or just choose not to have sex as well.
Cool. I feel like that kind of covers chlamydia. Are there any questions in the chat? Can we move on to gonorrhea?
No, we just shout out to No Filter DC for just dropping gems in the comments. We really stand.
Okay, so I'm going to go ahead and jump into gonorrhea. I'm not going to lie. Gonorrhea, which is also called the clap, you might have heard that, it has a lot in common with chlamydia. So they're both pretty common bacterial infections. Gonorrhea is a little less common. Around 1 million infections occur per year in the US as opposed to 3 million for chlamydia. Half of gonorrhea's infections occur in young people ages 15 to 24. Like chlamydia, you can get gonorrhea by having anal, oral, vaginal front hole sex, or through childbirth. Like chlamydia, gonorrhea is asymptomatic, although I will note that more people who have gonorrhea experience symptoms than people with chlamydia. And the symptoms for gonorrhea and chlamydia are both really similar. You probably will, if you experience anything, will experience urethral and rectal discharge, painful urination, pain and discomfort in like the abdomen, pelvis, scrotum, rectum area, even bleeding in the rectum and vagina front hole. So, and also like chlamydia, you can cure gonorrhea easily with medication. And if you don't, you can experience what Marshun was talking about earlier, pelvic inflammatory disease, infertility, or ectopic pregnancy. And, like chlamydia, you can prevent against gonorrhea by using condoms correctly, talking with your sex partner about their status, considering having a long-term mutually monogamous relationship with the partner who's been tested, or just choose not to have sex at all. I ran through that kind of quickly, but I just feel like there's a lot of overlap between gonorrhea and chlamydia. And, the same reasons why it's important to get tested for chlamydia, reasons why it's important to get tested for gonorrhea. Do you have any questions, Marshun?
No. I often hear like people refer to gonorrhea as like the little sister and chlamydia is like the big sister.
Yeah.
But I guess they kind of make sense. I feel like, like I said, they're very alike, chlamydia and gonorrhea, except for gonorrhea is a little less common and you're more likely to have symptoms with gonorrhea rather than chlamydia. But definitely no questions.
Yeah, I think that like pretty much covers it. That's a good like way to differentiate between the two. And since symptoms overlap between chlamydia and gonorrhea, or they're just non-existent, it's really important that you get tested to figure out what you have or if you have anything. Again, call Whitman-Walker at 202-797-4439. Set up an appointment for HIV/STI testing.
Let's just see if we have any questions. Let's see. I don't believe so.
Okay, so why don't we then move on to our last STI on syphilis?
Okie dokie, sounds great. We did put these 3 diseases in one live for a reason, you guys. Even though I know that we could talk about each one of them individually for such a long time. They're all very similar. Syphilis, as we're moving to, is relatively common. Around 115,000 people were reported in United States cases last year. The majority of those come from MSMs, who are men who have sex with men. You can get syphilis from sexual contact or from childbirth. However, though syphilis can sometimes go unnoticed, it has a different set of symptoms for chlamydia and gonorrhea. And I just know Brendan is going to tell us all about them.
Yeah, so like I think gonorrhea, I hear the clap a lot. A nickname for syphilis is the Great Pretender. And
I've
that's because
never heard of that.
I I heard it maybe once. Like I think it's an older term.
Okay.
But they call it that because it has a really wide range of symptoms that can look a lot like other diseases. So someone with syphilis will experience symptoms in four different stages that are pretty distinct. Um, the first like few weeks after you get infection, usually like the first 3 to 6 weeks, called the primary stage. One or more firm round sores called cankers or chancres will appear wherever the syphilis has entered the body. So you might see these like little pustules in and around the genitals, the
In
mouth,
your
the
hands.
um, it's mostly like the genitals, the mouth, and the rectum. And then they can be really small and go unnoticed, or they can be pretty big and like look really weird to you. Especially if they're internal, you won't notice them. Like if they're inside the mouth or the rectum, you might not notice them. And they're gonna last for a few weeks, and they'll even heal without getting treatment. If you don't get treated, you go on to the secondary stage of the disease. Marshun, what's in the secondary stage of syphilis?
The secondary stage of syphilis is kind of when it gets really syphilis. That's when you start seeing skin rashes, and different lesions may appear in your hands and your palms. You might experience fever, sore throat, fatigue, and other symptoms that look pretty much like any other general flu-like illness. These symptoms will go away for a few weeks, even without treatment. But again, if you don't get tested, you can go to the latent and tertiary stages. I'm
Tertiary stage, yeah.
tertiary. Oh my God, I'm like, what is that word?
Well,
Stages
tertiary is
of
like third.
syphilis. Right.
Yeah, so the latent stage can last for years and you just don't experience any symptoms. Um, it's just kind of hanging out in your body. But the last stage, called the tertiary stage, will happen if you still haven't gotten treatment after all these years. And that's where syphilis bacteria starts causing major damage in your organs, like your brain, your nerves, your eyes, your heart, your liver, your blood vessels, your bones, your joints. Um, Tertiary syphilis, if you progress to this stage, can even be fatal. Um, Also, like, regardless of the stage that you're in, at any point in the infection, syphilis bacteria can go into your brain and your eyes and cause permanent dementia, blindness, or paralysis, which is really freaky.
Right. Fun fact, a lot of famous people have actually died from syphilis, including gangster rapper Al Capone, ragtime pianist Scott Joplin, and Edgar Monet, philosopher Frederick Nietzsche,
Nietzsche.
Nietzsche, and author Oscar Wilde.
Yeah, a lot of people get syphilis historically and like even in the present. What's nice now, we don't want to scare you too badly. Like a lot of these fatal deaths occurred because we didn't have treatment back then. Like back in like Al Capone, Scott Joplin's time, like testing treatment wasn't great.
Right.
Now you will really only go on to develop tertiary syphilis um, if you don't get tested and then treated. A lot of people go on to develop tertiary syphilis or increase their risk of getting HIV today just because they're not treated or tested.
Yes. And we're not trying to scare you guys too badly, especially with fatal syphilis. Most of those deaths occur because we didn't have treatment, like Brendan said back then. But a lot of people do go on and develop tertiary syphilis or increase their risk of getting HIV today just because they're never tested and treated, which is why, we do recommend routine testing every 3 to 6 months for HIV and STIs.
Treatment is super easy for all of these infections we talked about today. Syphilis, you just come in, get antibiotics, and you're pretty much all set.
Yes. And it's even easier to prevent against syphilis by doing the same things we've been talking about this entire time, and that's just like using condoms correctly, talking with your partner about their status, and also having a long-term mutually monogamous relationship with a partner who has been who has been tested, or just we're staying from having sex altogether. I know there was a lot of material we just dropped, and we kind of maybe like rushed through it a little bit. But if you guys have any questions in regards to gonorrhea, chlamydia, or syphilis, or testing, feel free to hit us up in the comments. Or if you're not comfortable writing your question in the comments, you can always give us a call at the number we have pinned below.
Yeah, write in the comments, DM us, call us. We're here to answer your questions.
Yes. Okay. So, Brendan, is there anything else you want to mention? No?
If there are no more questions, I think the only thing that we'll say in closing is please get routinely tested for STIs if you're sexually active. You don't always know when you have an STI, and you want to protect your own health and your partner's health.
Absolutely. And Whitman-Walker is definitely here to support you with the process. You can give us a call at the number we have pinned below, 202-797-4439, if you want to get tested for HIV or STIs. You can also call that same number if you think you have symptoms of an STI or HIV, or if you've been exposed. We are absolutely here to help you.
This is also a reminder, separate from STIs, that COVID-19 is still very much around. Last week, over 100,000 people were hospitalized with COVID, and the death toll, I think probably tomorrow, will reach 300,000 in America.
Yes.
It's up to all of us to slow the spread of the virus, and we can do that by wearing a mask, social distancing, washing our hands, staying at home, especially if you're feeling sick, and encouraging your friends to do the same.
Yes, and we also offer COVID testing as well. We can actually provide that number in the comments as well for anyone who, feels like they may need COVID testing. Or you can call that number that we have pinned and we can transfer you to whoever, just because our phones are kind of crazy. As you can hear, it's going up now. But with that being said, if you want to check out more videos like the one you're viewing now, follow us on Instagram at Whitman-Walker. You can also follow us on Twitter at Whitman-Walker as well. And our Facebook is Whitman-Walker Health. And you can follow us on there as well. I want to thank everyone for joining us. If anyone has any questions, you give us a call. You can write them in the comments, DM us. Please wear a mask, you guys, that covers both your nose and your mouth. And thanks for tuning in.
Thanks, Marshun. That was awesome.
Bye, Brendan. TTYL.
Bye, everyone. Bye, Marshun.